This is the Coronavirus Morning Report for Thursday, April 30th, 2020. I'm Jackson Bird. Today, we've got a deep dive into the hopes surrounding remdesivir as a potential treatment drug, a high-level summary of the current status around the world, why some COVID-19 patients don't sense they're low on oxygen, some more clues as to why some recovered patients test positive again later, and a look at the people stepping forward to risk their lives for a COVID vaccine. Should we let them? The big news over the last 24 hours has been the glimmer of hope surrounding the experimental drug remdesivir, which shows promise as a treatment for coronavirus. And we're going to give this news its own segment immediately following this top news segment, so hold on for that. But first, I thought it might be worth summarizing the state of things across the globe at the moment without just throwing a ton of numbers at you. So in a very broad, high-level way, things look like this. Italy, Spain, Germany, and France seem to be effectively lowering their curves. Sweden and Canada are still near the peak of their diseases, possibly plateauing, but need a few more days of data there. Note that Britain is sadly on track to surpass Italy's total for the most number of deaths in Europe. Absolutely no new cases in both South Korea and Hong Kong over the last 23 hours. In fact, Hong Kong has had no new cases for 5 straight days. And also, South Korea was one of the early places to peak, if you'll recall, recording 909 cases on February 29th alone. Vietnam, despite its 95 million person population, has still not reported a single death, and only 270 cases. Meanwhile, Sri Lanka has reintroduced a strict 24-hour curfew as a number of new coronavirus cases has surged there. And Japan will apparently extend its national state of emergency to June as the country is experiencing a second wave of infections. In the U.S., again, in a very broad way, looking at the case number graphs, the number of new cases are trending up in Massachusetts, Illinois, Maryland, Indiana, Virginia, Colorado, Tennessee, and North Carolina. Things are flat in New York, California, Pennsylvania, Michigan, Texas, Washington State, Rhode Island, and Missouri. All of those are off of their peaks, some significantly. And the states where cases are decreasing: New Jersey, Florida, Louisiana, Connecticut, Georgia, Ohio, South Dakota, and Idaho. And yes, this is a sad statistic to end with. The U.S. passed 60,000 official coronavirus deaths since we last spoke. Quoting the Washington Post, the California Police Chiefs Association has told its members that Governor Gavin Newsom plans to announce Thursday that all beaches and state parks will be closed effective Friday. The anticipated move follows a weekend in which thousands of people took advantage of warm weather and crowded California beaches in violation of social distancing restrictions in place in the state, prompting Newsom to warn of the potential of a second wave of the coronavirus outbreak, end quote. Dr. Anthony Fauci told CNN last night that the long-awaited day where capacity for testing in the U.S. should reach the point where anyone who wants a test can get one is about a month away. Specifically, his quote was, "Hopefully we should see that as we get towards the end of May, the beginning of June," end quote. And the number of nursing homes reporting cases of COVID-19 in the U.S. has doubled in the past week, with more than 1 in 6 elder care facilities in the U.S. now acknowledging infections among residents or staff. In 5 states, Maryland, Massachusetts, Connecticut, Georgia, and New Jersey, the virus has struck a majority of nursing homes. And in New Jersey, infections have been reported at 80% of the state's nursing homes. Finally, this is quoting the New York Times. The British-based pharmaceutical giant AstraZeneca said on Thursday that it had reached an agreement to make and distribute a leading potential coronavirus vaccine. The drug, developed by scientists at Oxford, is now in human trials. The Oxford researchers are at the forefront of the race for a vaccine because they had already demonstrated the safety of similar potential inoculations for other viruses. That has enabled them to schedule human trials of their vaccine that will involve 6,000 people by the end of next month. If those succeed, the scientists hope to distribute the first few million doses to frontline healthcare workers as early as September. The deal with AstraZeneca could help ensure that a potential vaccine is available in the United States and around the world. End quote. A government-run study of Gilead Sciences' remdesivir showed that the drug is effective at treating COVID-19, the National Institutes of Health has announced. In a statement, Gilead said that the study had reached its primary endpoint, meaning that patients on remdesivir recovered more quickly than those taking a placebo. Dr. Anthony Fauci, head of the National Institute of Allergy and Infectious Diseases, or NIAID, told reporters that the data from the trial showed a, quote, clear-cut positive effect in diminishing time to recover, and added that this will be the standard of care. We've talked about remdesivir a lot in recent shows. Early data from a trial in Chicago indicated that patients were doing better than expected on the drug. Then those hopes were tempered somewhat when a study in China indicated that patients taking remdesivir didn't do any better than those in a control group. In this NIAID study, remdesivir was compared to placebo in 1,063 patients, with neither doctors nor patients knowing who actually got the drug. In a statement, the NIAID said, an independent data and safety monitoring board overseeing the trial met on April 27th to review data and shared their interim analysis with the study team. Based upon their review of the data, they noted that remdesivir was better than placebo from the perspective of the primary endpoint, time to recovery, a metric often used in influenza trials. Recovery in this study was defined as being well enough for hospital discharge or returning to normal activity level. Preliminary results indicate that patients who received remdesivir had a 31% faster time to recovery than those who received placebo. Specifically, the median time to recovery was 11 days for patients treated with remdesivir, compared with 15 days for those who received placebo. Results also suggested a survival benefit, with a mortality rate of 8% for the group receiving remdesivir versus 11.6% for the placebo group, end quote. The FDA is expected to issue an emergency use authorization for the drug. Gilead, the maker of remdesivir, also revealed initial results from its own Phase 3 trial of the drug, in which it is comparing 5-day and 10-day courses of treatment. The company found that a 5-day course is essentially just as effective as a longer course, meaning the existing supply of the drug could be used to treat a greater number of patients. Unlike the NIAID study, there was no control group, so the study doesn't speak to remdesivir's overall effectiveness. Merdad Parsi, Gilead's chief medical officer, said in a statement, unlike traditional drug development, we are attempting to evaluate an investigational agent alongside an evolving global pandemic. Multiple concurrent studies are helping inform whether remdesivir is a safe and effective treatment for COVID-19 and how to best utilize the drug. These study results complement data from the placebo-controlled study of remdesivir conducted by the National Institute for Allergy and Infectious Diseases and help to determine the optimal duration of treatment with remdesivir. The study demonstrates the potential for some patients to be treated with a 5-day regimen, which could significantly expand the number of patients who could be treated with our current supply of remdesivir. This is particularly important in the setting of a pandemic to help hospitals and healthcare workers treat more patients in urgent need of care, end quote. Scott Gottlieb, the former commissioner of the Food and Drug Administration, told STAT, remdesivir isn't a home run, but looks active and can be part of a toolbox of drugs and diagnostics that substantially lower our risk heading into the fall. And adding to the good news today, running in parallel to the possible genesis of a COVID-19 treatment, it looks like vaccine development is moving more quickly than expected. Pfizer said it will start testing an experimental vaccine as early as next week, with it being available for emergency use this fall if it succeeds in initial studies. The Pfizer effort joins at least 3 others, moving at a rapid clip. As we said at the top, a team at Oxford University is working on a vaccine candidate that could be ready as early as September. Moderna's vaccine is about to enter a second round of human testing, and Johnson & Johnson said recently that it expects to start human testing of its vaccine in September, with availability early next year. One curiosity of COVID-19 is that patients are presenting with very low oxygen levels despite being wide awake, not feeling short of breath, and holding conversations, until their oxygen saturation gets so low that they suddenly turn for the worse. According to a piece in Science magazine, clinicians call such patients happy hypoxics. Quoting from the piece, a normal blood oxygen saturation is at least 95%. In most lung diseases, such as pneumonia, falling saturations accompany other changes, including stiff or fluid-filled lungs or rising levels of carbon dioxide because the lungs can't expel it efficiently. It's these features that leave us feeling short of breath, not, counterintuitively, low oxygen saturation itself, says Paul Davenport, a respiratory physiologist at the University of Florida. The brain is tuned to monitoring the carbon dioxide with various sensors, Davenport explains. We don't sense our oxygen levels. In serious cases of COVID-19, patients struggle to breathe with damaged lungs. But early in the disease, low saturation isn't always coupled with obvious respiratory difficulties. Carbon dioxide levels can be normal, and breathing deeply is comfortable. Quote, the lung is inflating so they feel okay, says Elnara Marcianegri, a pulmonologist in Sao Paulo. But oxygen saturation, measured by a device clipped to a finger and in many cases confirmed with blood tests, can be in the 70s, 60s, or 50s, or even lower. Although mountain climbers can have similar readings, here the slide downward some doctors believe is potentially ominous, says Nicholas Caputo, an emergency physician at New York City Health and Hospitals Lincoln. End quote. Doctors think that COVID-19's effect on clotting, which we've covered before on this podcast, may be involved. They hypothesize that microclots form in the lungs early on, preventing blood from getting properly oxygenated, but not causing the kinds of breathing difficulties that would usually accompany low oxygen levels. So what can be done about it? Richard Levitan, an emergency doctor in Littleton, New Hampshire, wrote an op-ed in the New York Times about the benefits of home pulse oximetry. Quoting from his piece, there's a way we could identify more patients who have COVID pneumonia sooner and treat them more effectively, and it would not require waiting for a coronavirus test at a hospital or a doctor's office. It requires detecting silent hypoxia early through a common medical device that can be purchased without a prescription at most pharmacies, a pulse oximeter. Pulse oximetry is no more complicated than using a thermometer. These small devices turn on with one button and are placed on a fingertip. In a few seconds, two numbers are displayed: oxygen saturation and pulse rate. Pulse oximeters are extremely reliable in detecting oxygenation problems and elevated heart rates. Widespread pulse oximetry screening for COVID pneumonia, whether people check themselves on home devices or go to clinics or doctor's offices, could provide an early warning system for the kinds of breathing problems associated with COVID pneumonia. People using the devices at home would want to consult with their doctors to reduce the number of people who come to the ER unnecessarily because they misinterpret their device. There may also be some patients who have unrecognized chronic lung problems and have borderline or slightly low oxygen saturations unrelated to COVID-19, end quote. Levitan goes on to recommend that anyone who tests positive for coronavirus should monitor their oxygen levels for 2 weeks, as should anyone with cough, fatigue, and fevers. You may have heard some of the cases where people who contracted COVID-19 and recovered subsequently retested positive for the coronavirus. Well, some good news on that front. South Korea's Central Clinical Committee for Emerging Disease Control said there was no live virus present in such cases, reports the Yonhap news agency. The Korean CDC reports that a total of 255 people who've recovered from COVID-19 have retested positive. But the finding means that there was no reactivation or reinfection of the coronavirus. It was just that the test was picking up inactive fragments of the virus. Oh Myong-don, head of the committee, told Yonhap that COVID-19 is no different to viruses like HIV or hepatitis B, which cause chronic infections by staying dormant inside a cell nucleus until reactivating at a later time. Oh said, quote, the COVID-19 virus does not invade inside of the cell nucleus and combine with a patient's DNA. It means that the virus does not create chronic infections, end quote. So, as best as we can tell at this point, once you're recovered from COVID-19, there are no signs of it reactivating or that you're immediately susceptible to reinfection.
When my wife found out Beachbody On Demand was going to be one of the sponsors of the show this week, she was over the moon.
I've had some of those videos for years. Are you telling me they're streaming now?
It's actually just this week given her the opportunity to dive back into the Beachbody catalog.
Well, what else am I going to do for exercise right now? This is perfect.
She got me to do the Morning Meltdown 100 with her this morning. We streamed it on my son's iPad, actually, because it has one of those kids' cases with the kickstand on it, and we propped it up in front of the couch and just banged it right out. Let me tell you, after 3 weeks of literally doing zero exercise, like not closing any of the rings on my smartwatch, I feel much better today, relaxed, clear-headed. I want you to try this because chances are you've been cooped up just like me. Let's get in shape together. Listeners to this podcast can get a special free trial membership of Beachbody On Demand when you text briefing to 303030. You will get full access to the entire Beachbody On Demand platform for free, all the workouts, the nutrition information, even support totally free. Again, just text briefing to 303030. Is there something maybe interfering with your happiness at the moment, preventing you from achieving your life goals? Goodness knows there are a lot of life goals on hold at the moment, and goodness knows that being in therapy myself has helped me work through a lot of frustration these last few weeks. That's why I want to talk to you about BetterHelp. BetterHelp is not a crisis line. It's not self-help. It is professional counseling done securely online. BetterHelp will assess your needs and match you with your own licensed professional therapist. You can start communicating in under 24 hours. In a way, BetterHelp can do things in-person therapists can't. There's a broad range of expertise available on BetterHelp, which may not be locally available in many areas. The service is available for clients worldwide, and it's on call anytime you need it. You can log into your account anytime and send a message to your counselor. Visit betterhelp.com/report. That's BetterHelp. And join the over 800,000 people taking charge of their mental health with the help of an experienced professional. Special offer for Coronavirus Morning Report listeners. Get 10% off your first month at betterhelp.com/report.
COVID-19 is probably killing more people than official statistics show, according to new analyses. The New York Times reports that total deaths in 7 states are running at 50% above normal, representing 9,000 more deaths than were captured by the official count of deaths caused by the coronavirus. Quoting from the Times, "The new data is partial and most likely undercounts the recent death toll significantly, but it still illustrates how the coronavirus is causing a surge in deaths in the places it has struck, probably killing more than the reported statistics capture. These increases belie arguments that the virus is only killing people who would have died anyway from other causes. Instead, the virus has brought a pattern of deaths unlike anything seen in recent years." If you look at the provisional death counts from all causes, death counts in New York, New Jersey, Michigan, Massachusetts, Illinois, Maryland, and Colorado have spiked far above their normal levels for the period. In New York City, the home of the biggest outbreak, the number of deaths over this period is more than 3 times the normal number. Recent data suggests it could have reached 6 times higher than normal, end quote. The Times compared the provisional death counts with the average number of deaths each week over the past 5 years, generating the excess deaths number. Quoting again from the piece, "There is evidence in New York and other places that the official coronavirus counts are probably too low. Tests for the illness can be hard to get, and not all who die now are being tested, particularly if they die outside a hospital. New York City recently revised its own statistics for the number of coronavirus-related fatalities, saying thousands of additional deaths were probably because of COVID-19, even though no tests had been conducted. There's also increasing evidence that stresses on the healthcare system and fears about catching the disease have caused some Americans to die from ailments that are typically treatable. A recent draft paper found that hospital admissions for a major type of heart attack fell by 38% in 9 major U.S. hospitals in March. In a normal year, cardiovascular disease is the country's leading cause of death." End quote. The numbers closely match those produced by a Financial Times study of death counts across 14 countries hit by the pandemic. The Financial Times found that the global COVID-19 death toll could be as much as 60% higher than officially reported, with 122,000 excess deaths compared to 77,000 deaths officially attributed to coronavirus for the same time periods and locations. Scaled worldwide, that could mean the number of COVID-19 deaths, currently reported by Johns Hopkins as over 225,000, could in fact be well over 350,000. Adding to the cautiously optimistic news at the top of the show about vaccine developments occurring more quickly than anticipated, Let's talk about one way we could get a vaccine even faster. Human challenge trials. A challenge trial differs from a typical vaccine trial in that the subjects are deliberately exposed to the infection instead of waiting for them to be infected naturally. Doing so would substantially speed up the timeline of vaccine development and potentially save thousands to millions of lives. But who would sign up to be injected with COVID-19? As of writing, 8,219 people. They've signed up as interested in being exposed to the virus for the benefit of vaccine development on the website of a new grassroots organization called One Day Sooner. To be clear, One Day Sooner is not affiliated with any group that is currently running vaccine trials, so the people signing up on their website are just making a point, not formally signing up to join trials. But they are among a growing number of researchers and lawmakers calling on the FDA and the Department of Health and Human Services to support human challenge trials. Quoting Vice, "There are more than 70 vaccine candidates right now, but the most optimistic estimates for when a coronavirus vaccine might be available to the public are between March and August 2021. We've done human challenge studies before for less deadly diseases like influenza, but the risks of challenge trials are real. In 2001, a 24-year-old woman died in a challenge experiment for an asthma treatment. Researchers who conduct human challenges have said a COVID-19 trial would be riskier since there's so much we still don't know about it." End quote. So should we allow human challenge trials to happen? Arthur Kaplan, a bioethicist at New York University, told Vice, quote, "In this case, it's not really a difficult calculation. We've already seen over 50,000 deaths in the U.S. If we go at the pace a vaccination normally takes, it's probably 4 to 5 years to get everything done. We're presuming the virus rebounds aren't going to come back less nasty. The death toll indicates there's absolutely a strong ethical case to ask people if they're willing to do this." End quote. Kaplan points to a number of factors that would need to be controlled were challenge trials to happen, however. For one, it needs to be done on a vaccine that has a chance of actually being able to be manufactured quickly enough. No point testing a vaccine that will take 5 years just to manufacture 1 million, he says. You'll also probably want to test healthy people within the 20 to 35-year age range because, besides kids, they're the age range least likely to die from coronavirus. The trial subjects will also need somewhere like a medical facility to reside at so that they can be treated at the first sign of trouble. And they'll need to really be pushed on their consent. Kaplan even suggests quizzing trial volunteers so that they really understand what they're signing up for and that dying is a very real possibility. Finally, he says subjects should probably not be paid beyond expenses so that people aren't tempted to volunteer just to get paid. It's a serious proposal, but not one that's unprecedented or bending the rules of science whatsoever, Kaplan says. It's just asking a lot of people who volunteer. But Kaplan thinks we should let people do it who truly want to help. He says, quote, "Look at the kinds of work people are already doing. First responders going in with inadequate equipment and taking the same risk we're talking about. Those people are out there. We're calling them heroes." And that is it for today. As always, this show was produced by Ride Home Media. If you want to pitch us stories, you can do that on our Facebook at facebook.com/coronavirus morning report or on our subreddit, reddit.com/r/coronavirus pod. Talk to you again tomorrow. Be well.